CEN Test Prep Course. Question 1. A patient has been exposed to cyanide. What is the most characteristic finding? Option A, cherry minus red skin. Option B, cyanosis. Option C, slate minus gray skin. Option D, flushing. The correct answer is option A, cherry minus red skin. Cyanide poisoning causes a classic cherry minus red skin color due to high venous oxygen saturation from impaired cellular oxygen utilization. Cyanosis, B, is seen in hypoxia from other causes. Slate minus gray skin, C, is seen in methemoglobinemia. Flushing, D, is nonspecific. Question 2. Which of the following ECG findings is most consistent with pericarditis? Option A, ST- segment elevation in all leads with reciprocal depression. Option B, diffuse ST- segment elevation with PR- segment depression. Option C, ST- segment elevation in contiguous leads with reciprocal changes. Option D, pathologic Q waves in leads 2, 3, and AVF. The correct answer is option B, diffuse ST- segment elevation with PR- segment depression. Acute pericarditis classically presents with diffuse, global, ST- segment elevation across most leads along with PR- segment depression. The ST- segment elevation is concave upward and does not have reciprocal changes. Option A describes STEMI, which typically shows ST elevation in contiguous leads with reciprocal depression. Option C also describes STEMI. Option D describes a prior inferior wall ME. Question 3. Which nursing intervention is most important for a patient with an ING tube to low intermittent suction? Option A, change the ING tube every 24 hours. Option B, provide frequent mouth care. Option C, maintain the patient in a supine position. Option D, flush the tube every 8 hours with 50 ml of sterile water. The correct answer is option B, provide frequent mouth care. ING tube to suction can cause a dry mouth and sore throat. Frequent mouth care, including oral hygiene and moisturizing lips, is essential. The tube does not need to be changed daily. A. Supine position. C. Increases risk of aspiration. Flushing. D. Depends on hospital policy and should not use large volumes. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with a history of DVT presents with sudden onset of chest pain and dyspnea. What is the priority nursing action? Option A, administer oxygen. Option B, obtain a 12-lead ECG. Option C, prepare for CT angiography. Option D, administer heparin. The correct answer is option A, administer oxygen. The ABCs are the priority. Administering oxygen to treat hypoxemia is the first step. ECG, B, is used to rule out ME but is secondary. CT angiography, C, is diagnostic but not the priority. Heparin, D, is treatment but follows oxygen and diagnosis. Question 5. A patient presents with signs of hypothermia. Which core temperature indicates severe hypothermia? Option A, 32 degrees Celsius. Option B, 30 degrees Celsius. Option C, 28 degrees Celsius. Option D, 26 degrees Celsius. The correct answer is option C, 28 degrees Celsius. Severe hypothermia is defined as a core temperature below 28 degrees Celsius (82.4 degrees Fahrenheit). At this temperature, the patient may be unconscious with minimal or absent vital signs. Mild hypothermia, 32-35 degrees Celsius, A, moderate, 28-32 degrees Celsius, B, and severe, 28 degrees Celsius, C. Option D, 26 degrees Celsius, is also severe, but 28 degrees Celsius is the threshold. Question 6. A patient with acute ischemic stroke arrives at the ED 2 hours after symptom onset. Which question is most important for determining eligibility for thrombolytic therapy? Option A, what is the patient's blood pressure? Option B, what time were the patient's symptoms last known to be normal? Option C, does the patient have a history of hypertension? Option D. What is the patient's family history? The correct answer is option B. What time were the patient's symptoms last known to be normal? The time of last known normal is the most critical factor for determining eligibility for thrombolytic therapy with TPA. The window is up to 4.5 hours for select patients. Blood pressure, A, is also important, but the time window is the primary determinant. History of hypertension, C, is relevant but not as critical. Question 7. A patient with an open fracture of the tibia is brought to the ED. What is the priority nursing intervention? Option A. Administer 4 antibiotics. Option B. Cover the wound with a sterile dressing. Option C. Check distal pulses and sensation. Option D. Apply a splint. The correct answer is option C. Check distal pulses and sensation. In any fracture, especially open fractures, neurovascular assessment distal to the injury is the priority. Checking pulses and sensation ensures there is no vascular compromise or nerve injury. For antibiotics, A, wound dressing, B, and splinting, D, are important but secondary to neurovascular assessment. Question 8. A patient with cirrhosis presents with hematemesis. What is the most likely source of bleeding? Option A, peptic ulcer. Option B, esophageal varices. Option C, gastritis. Option D, a Mallory-Weiss tear. The correct answer is option B, esophageal varices. Patients with cirrhosis develop portal hypertension, leading to esophageal varices. These are fragile and prone to bleeding, causing hematemesis. While peptic ulcers, A, gastritis, C, and Mallory-Weiss tears, D, can also cause upper GI bleeding, esophageal varices are the most likely source in a patient with cirrhosis. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with abdominal pain, vomiting, and a blue-gray discoloration of the gums. What heavy metal poisoning is most likely? Option A, mercury. Option B, arsenic. Option C, lead. Option D, iron. The correct answer is option C, lead. Lead poisoning can cause abdominal pain, lead colic, vomiting, and the classic blue-gray lead line at the gingival margin. Mercury, A, causes neurological symptoms. Arsenic, B, causes garlic odor and GI symptoms. Iron, D, causes GI symptoms and metabolic acidosis but not gingival discoloration. Question 10. A 25-year-old female presents with acute onset of severe lower abdominal pain and vaginal bleeding. The patient states she is 8 weeks pregnant. What is the priority nursing action? Option A, administer 4 fluids. Option B, obtain a urine pregnancy test. Option C, prepare for immediate surgery. Option D, assess for signs of hypovolemic shock. The correct answer is option D, assess for signs of hypovolemic shock. The patient's presentation of pain and bleeding in early pregnancy is concerning for ectopic pregnancy or spontaneous abortion. Hypovolemic shock can develop rapidly with intra-abdominal bleeding. Assessment of vital signs and signs of shock are the priority. For fluids, A, may be needed, but assessment comes first. A urine pregnancy test, B, is unnecessary, as the patient already knows she is pregnant. Surgery, C, may be needed but is not the first step. Question 11. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A, administer 4 lorazepam. Option B, assess for head injury. Option C, obtain a stat CT scan. Option D, perform a detailed neurological assessment. The correct answer is option A, administer 4 lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuro assessment, D, will be performed after the seizure terminates. Question 12. A patient presents with a temperature of 101.4 degrees Fahrenheit, heart rate of 110 beats/min, and respiratory rate of 26 breaths/min. To consider if the patient may have sepsis, the nurse should assess if the patient has Option A, a possible infection. Option B, positive blood cultures. Option C, an immunocompromised state. Option D, been febrile over 24 hours. The correct answer is Option A, a possible infection. According to the current definition of sepsis, a patient with signs of infection, fever, tachycardia, tachypnea, should be assessed for a possible source of infection. Sepsis is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. Positive blood cultures, B, are not required for diagnosis. Immunocompromised state, C, is a risk factor. Duration of fever, D, is less relevant. Question 13. An epidural hematoma is most commonly associated with which mechanism of injury? Option A, striking the head on a hard surface. Option B, rapid deceleration injury. Option C, injury to the temporal bone with laceration of the middle meningeal artery. Option D, acceleration-deceleration injury causing shearing forces. The correct answer is Option C, injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Question 14. A patient is diagnosed with bacterial meningitis. The nurse anticipates the following finding on physical examination. Option A, positive Kernig's sign. Option B, positive Hohmann's sign. Option C, positive Brzezinski's sign. Option D, both A and C. The correct answer is Option D, both A and C. Kernig's sign, resistance to passive leg extension with the hip flexed, and Brzezinski's sign, involuntary hip flexion with passive neck flexion, are classic signs of meningeal irritation in bacterial meningitis. Both may be present. Hohmann's sign, B, is associated with deep vein thrombosis. Question 15. A patient presents with a patellar dislocation. The nurse should monitor for associated injury to the Option A, femoral artery. Option B, sciatic nerve. Option C, popliteal artery. Option D, tibial nerve. The correct answer is Option C, popliteal artery. Patellar dislocation can cause injury to the popliteal artery, which lies behind the knee joint. The nurse should assess distal pulses and capillary refill. Femoral artery, A, is more proximal. Sciatic nerve, B, is more posterior. Tibial nerve, D, is also in the popliteal area, but the popliteal artery is the most critical vascular structure. Question 16. A patient is diagnosed with a UTI and prescribed nitrofurantoin. What is an important patient education point? Option A, take the medication with milk. Option B, complete the entire course of antibiotics. Option C, the medication may turn the urine bright orange. Option D, avoid foods high in tyramine. The correct answer is Option B, complete the entire course of antibiotics. Completing the entire course of antibiotics is essential to prevent recurrence and antibiotic resistance. Nitrofurantoin should be taken with food, not milk. A, it may cause brown or rust-colored urine, not bright orange. C, tyramine avoidance, D, is important for MAOI medications. Question 17. A patient presents with stridor and drooling. What is the priority nursing action? Option A, assess the airway and prepare for possible intubation. Option B, obtain a lateral neck X-ray. Option C, administer nebulized epinephrine. Option D, administer 4 antibiotics. The correct answer is Option A, assess the airway and prepare for possible intubation. Stridor with drooling in an adult suggests epiglottitis, a life-threatening airway emergency. The priority is to secure the airway. The patient should not be agitated or have a throat examination. Lateral neck X-rays, B, may delay care. Nebulized epinephrine, C, may be used for croup but is not appropriate for adult epiglottitis. Antibiotics, D, are important but secondary to airway management. Question 18. In a mass casualty incident, which patient would be classified as green minor, according to START Triage? Option A. A patient with a fractured femur, respirations 20/min, pulse 100, able to follow commands. Option B. A patient with an open fracture of the tibia, respirations 24/min, pulse 110, able to follow commands. Option C. A patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. Option D. A patient with a large scalp laceration, respirations 22/min, pulse 100, confused. The correct answer is option C. A patient with a sprained ankle, respirations 18/min, pulse 90, able to walk. In START Triage, green minor, patients are those who are walking and have minor injuries. The sprained ankle patient who can walk is green. Fractures, A, B, are typically yellow delayed. Confusion, D, is a concern and may indicate need for more urgent care. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with Crohn's disease is at increased risk for which complication? Option A, toxic megacolon. Option B, intestinal obstruction. Option C, perforation. Option D, fistula formation. The correct answer is option D, fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 20. A patient presents with a chief complaint of suicidal ideation. Which of the following questions would be a priority for the nurse to ask? Option A, do you have a plan? Option B, what medications do you take? Option C, do you live alone? Option D, have you attempted suicide before? The correct answer is option A. Do you have a plan? When assessing a patient with suicidal ideation, determining if they have a specific plan, means, and intent is the priority. This directly addresses the patient's immediate risk. Other questions, B, C, D, are relevant for history but do not assess imminent risk as directly. Question 21. A patient is experiencing a tension pneumothorax following chest trauma. The nurse anticipates which intervention? Option A, needle decompression at the second intercostal space, midclavicular line. Option B, needle decompression at the fifth intercostal space, anterior axillary line. Option C, chest tube insertion at the second intercostal space, midclavicular line. Option D, supplemental oxygen and observation. The correct answer is option A, needle decompression at the second intercostal space, midclavicular line. Tension pneumothorax is a life-threatening condition requiring immediate needle decompression. The needle should be inserted at the second intercostal space in the midclavicular line on the affected side. This releases trapped air and relieves pressure on the heart and great vessels. The fifth intercostal space, B, is for chest tube insertion. Chest tube insertion, C, is the definitive treatment after needle decompression. Question 22. The nurse is caring for a patient who has been diagnosed with an advanced end-stage cancer. The medical team has suggested palliative care and hospice. Which of the following statements would be appropriate for the nurse to make when explaining the suggestion to the patient's family? Option A, palliative care begins with the initial diagnosis and continues through the end of life. Option B, the patient cannot change their end-of-life decisions once enrolled in hospice. Option C, there is an important legal distinction between withholding care and withdrawing care. Option D, a living will names a person to make medical decisions if the patient is unable to do so. The correct answer is option A. Palliative care begins with the initial diagnosis and continues through the end of life. Palliative care is appropriate at any stage of a serious illness, starting at diagnosis, and can be provided alongside curative treatment. It is not limited to end of life. Hospice is one type of palliative care for end of life. Patients can leave hospice at any time. B. Withholding and withdrawing care, C, are not what is being explained. A living will, D, is a legal document specifying treatment wishes, while a healthcare proxy names a decision-maker. Question 23. A patient presents following a motor vehicle crash with hoarseness, marked left lateral neck swelling, and respiratory difficulty. The priority intervention for this patient is? Option A, tracheal intubation. Option B, 4 fluids. Option C, needle cricothyrotomy. Option D, pleural decompression. The correct answer is option C, needle cricothyrotomy. This patient has signs of impending airway obstruction from a laryngeal or tracheal injury, hoarseness, neck swelling, and respiratory distress. The swollen and distorted anatomy makes oral or nasal intubation, A, likely to be impossible or dangerous. Needle cricothyrotomy, C, provides immediate airway access below the injury. 4 fluids, B, and pleural decompression, D, are not the priority for airway compromise. Question 24. A patient is receiving packed red blood cells. 15 minutes into the transfusion, the patient reports chills, flank pain, and shortness of breath. What is the nurse's priority action? Option A, slow the infusion rate. Option B, stop the transfusion immediately. Option C, administer diphenhydramine. Option D, notify the provider. The correct answer is option B, stop the transfusion immediately. This patient is experiencing signs of a possible transfusion reaction, chills, flank pain, dyspnea. The immediate priority is to stop the transfusion, keep the 4-line open with normal saline, and notify the provider. Slowing the infusion, A, does not stop the reaction. Diphenhydramine, C, may be given but after stopping the transfusion. Question 25. A patient with increased intracranial pressure is at risk for Cushing's triad. Which of the following comprises Cushing's triad? Option A, hypertension, bradycardia, irregular respirations. Option B, hypotension, tachycardia, tachypnea. Option C, hypertension, tachycardia, Shane-Stokes respirations. Option D, hypotension, bradycardia, hypoventilation. The correct answer is option A, hypertension, bradycardia, irregular respirations. Cushing's triad is a late sign of increased ICP, indicating herniation is imminent. It consists of hypertension, widening pulse pressure, bradycardia, and irregular respirations. This compensatory response is the body's attempt to maintain cerebral perfusion.